We've lost an additional 15 people since I was with you the last time. Again, all I can say is just please offer up your prayers, call these people. Don't let them feel alone, please. The 7,107th death is a 67-year-old male from Wyoming County. The 7,100, y'all forgive me just one second, my phone just went off here. Jordan, somebody come and get this. Let me start all over. Out of every respect in the world. The 7,107th death is a 67-year-old male from Wyoming County. The 7,108th death, an 86-year-old male from Putnam County. The 7,109th death, a 93-year-old male from Boone County. The 7,110th death, a 67-year-old female from Boone County. The 7,111th death, an 84-year-old male from Ohio County. The 7,112th death, a 93-year-old male from Cabell County. The 7,113th death, a 92-year-old male from Berkeley County. The 7,114th death, an 81-year-old female from Marshall County. The 7,115th death, a 90-year-old female from Mason County. The 7,116th death, an 83-year-old female from Boone County. The 7,117th death, an 80-year-old female from Mingo County. The 7,118th death, a 62-year-old male from Summers County. The 7,119th death, a 79-year-old male from Ohio County. The 7,120th death, a 78-year-old female from Randolph County. The 7,121st death in West Virginia is a 94-year-old female from Kanawha County. Whew. We now have 3,358 active cases in West Virginia. Big jump. We have 992 new positive cases, since in the last 24 hours. Daily positivity rate at 9.85, cumulative rate at 8.26, recovered cases almost 539,000. But we have 325 people now that are hospitalized. 44 that are in the ICU units and 13 are on ventilators. You can see from the map we have 2 gold counties, Mercer and McDowell counties. All the rest of the counties are green and yellow. But the biggest things you need to dial into is we've jumped to 3,358 active cases, and we have 325 folks that are hospitalized with COVID in West Virginia now. I couldn't tell you enough about getting your booster shot. Our president of the United States has got COVID right now. He's had all of his shots and all of his 2 booster shots. He's in his late 70s. He's a perfect target to not make it through this. He was on today and everything, and you can see basically he's dealing with it like a COVID cold. How is he really handling that like that? And the answer is just as simple as it can possibly be. He's gotten all of his shots. He's gotten all of his shots, and we pray that all the outcome will be wonderful for him and his family. But absolutely, without having all those shots, it could be really, really, really bad. And right now, it looks like he's handling it as a cold, just a simple cold. And with that being said and everything, that's what I've said over and over and over. How can you not get vaccinated? How can you possibly not get your booster shot? We want to be respectful of everybody's wishes, but at the same time, it's my job. It's my job to come here and tell you just how important it is, how much risk you're taking by not having the shots. And absolutely, with your booster shot, without any doubt, get your booster shots. Please do that. The over 65 years of age now that have had at least 1 dose have jumped from 91.4 to 91.5. We keep making progress, slow but sure, but we keep saving lives by talking to you. I'm sure of that without any doubt. The vaccine calculator, use it. You know, you can go online and register and get signed up and everything. It'll tell you when to take your shots, and it's just another tool in the toolbox that helps all of us. Any other information that's on the COVID vaccine lines on our website. We have 89 outbreaks in our long-term care facilities, none in our church community, 95 inmate cases and 64 staff cases in corrections. I remind you all the time about our rental assistance program, our homeowners assistance program. There's real dollars that are out there. It won't take long to call and see if you qualify. Absolutely, it'll be a call that could be very, very beneficial to you. I remind you about giving blood over and over, you know, especially if you've had a blessing from God above that you've had this, survived it. Please talk to your physician and see, you know, if he or she would concur that you ought to consider this, and then think real hard about it. The Red Cross needs your blood. This is another wonderful thing going on in the state of West Virginia. It's a workers' comp reduction. Today, I'm proud to announce that the National Council on Compensation Insurance has filed a proposed workers' compensation loss cost decrease of 7.2% effective November 1st, 2022. You know, this will result in an additional $14 million of savings to the West Virginia employers. It's great economic news. We continue to decline, you know, in our workers' comp rate. All that does is just make it better and better to bring folks to West Virginia. Last thing I've got is yesterday we were at Stonewall, you know, an incredible facility, an incredible park in the state of West Virginia, and the First Lady announced that they're adding 5 new schools to the communities and schools across West Virginia. That brings the total number to 5 new counties. That brings the total number to 36 counties. The ones that were added yesterday were from Logan, Marshall, Monroe, Ohio, and Randolph counties. So with all of that, you know, prior to yesterday, there's been 70,000 plus kids that have been impacted by this program. I've said it 1,000 times. Really and truly, Kathy and I didn't know a whole lot about this. In fact, really and truly, Kathy started down the path with trying to do something really special with a program that she didn't know much about in the beginning. And all of a sudden it started to grow. And then it grew more and more. And absolutely the impact that all these people are making on children's lives is unbelievable. Let me just say this and say this just as point blank as I can possibly say it. I'm in the schools all the time. I've been a coach forever. I love being in the schools and being with the kids. And I can tell you unequivocally, I absolutely believe wholeheartedly that there's never been a program that I have seen that's working any better than the Communities in Schools program. Really and truly what is happening is just this. You have a kid that's in real trouble, a kid that's struggling just staying in school, a kid really that we could very well just lose along the way. And without question, a kid that can sometimes be really disruptive in a classroom. With all that being said, so many problems from the standpoint of maybe being cold in the winter, or maybe not having anything to eat, maybe not having anybody to really talk to. We see all the problems across America that can be really tragic and really bad. With all that being said, all these folks are touching lives, and they're turning things around like you can't imagine. You can't imagine how things are turning around for these kids. You can't imagine the benefit in the classroom to the teachers, and on and on and on. It's a program that is really, really, really knocking it out of the park. So I congratulate Kathy. I congratulate all those that are really absolutely making a lot of the thing, you know, turning the dial in every way. So that's all I've got, but boy, this is a good one. Thank you.
All right, Governor, give us just 1 second. We have a quick technical difficulty.
Okay.
All right, we apologize. We'll now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And following up with what the governor shared with us, we know that President Joe Biden has been diagnosed with COVID-19, and that presumably is the BA.5 Omicron variant, since that variant now accounts for approximately 70 to 75% of the cases that we are experiencing in the US. But because he has been fully vaccinated and fully boosted, along with getting treated immediately with Paxlovid, the oral treatment, he is functioning, as the governor shared, very well. And that is a really important point that I want to focus on for just a second. So we know that data from many different sources, including the Centers for Disease Control, gives us insight that people that are fully vaccinated, up to date with their vaccinations, have a substantial reduced risk of dying or going to the hospital with COVID-19. And in fact, as we've said, if you look against all forms of COVID-19, people that are immunized and over 50, boosted with the 2 shots, so a total of 4 shots, 2 boosters, have a 42 times reduced risk of dying versus people that haven't been vaccinated at all. But newer data from the CDC would look at that related to Omicron. And we know Omicron, the variants that we're facing now, are the most infectious forms of COVID-19 that we face today. And we know that reinfections with the BA.5 variant are more common than with previous variants. But what's really important to know is the people that are fully up to date with their vaccines, again, people over 50 years old who've received a total of 4 vaccines, that's the 2 primary shots and then 2 boosters, against Omicron, have still a 29 times reduced risk of dying versus people that have had no shots, and maintain that 4 times risk of dying, or reduced risk of dying, if they've had 4 shots versus 3 shots. And what's really, really sad is in the US today, if you look at the 50 to 64-year-old group, only about 50% of that group has had a 3rd shot, the first booster, and only 9% of that group has had the 4th shot, the second booster. And that is way too low, because we know how important and how protective the staying up to date with your shots are to reduce your risk of dying from COVID-19. Remember, in our country, we are now 1.02 million deaths, over 1 million deaths from COVID-19. And with the BA.5 variant in the country, the number of daily deaths has climbed up to now to be over 500, and hospitalization rates are climbing up. So we know that the BA.5 variant is not yet risen to its full potential in the US. And we know that West Virginia is a few weeks always behind the rest of the US and what we see with the different variants. So we can anticipate that BA.5 will come and have its full strength felt in West Virginia in the next several weeks. So this is really the right time to make sure that you go to the vaccine calculator. And if you're due for another shot, if you're due for a booster or a second booster, or even if you're due to get your primary series, this is really the best time to do it. And we hope people will do that, because we don't want the governor to read more names at the beginning of the next press conference in people who would have been protected from dying with appropriate up-to-date vaccination testing, so that you know if you have COVID, and then immediate focus on getting to you the right medications, including Paxlovid, all of which reduces your risk of dying from COVID-19. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. We will begin ordering the Novavax vaccine on Monday, so we'll start to see that for those who would wish to choose that. We do continue to still see slowly but steadily our vaccination numbers, to include booster numbers, go up and stay in a positive trending direction. As was pointed out, hospitalizations for today, 325 in the hospital. We see 44 in the ICU and 13 on ventilators, 67 additional people. So we continue to watch that, because the numbers of people being diagnosed and going into the hospital, that total head count is still staying relatively steady right at the moment. Most of those individuals are over the age of 50. One of the positive things that we are seeing as we analyze our numbers, in February of 22, we had 20.2% of the total population in the hospital in ICU and 13.2% who were on ventilators. But now we see on 6 this month, we saw a smaller percentage in ICU and a smaller percentage of our total in ventilators. I do want to reinforce, as the governor and Dr. Marsh pointed out, President Biden's piece, but from a personal family standpoint, just reinforce the governor's message to family members over the age of 80, both who had 4 shots and were able to get a course of Paxlovid, have been able to weather infection of the latest version of Omicron relatively effectively. So again, from a personal standpoint, I've seen up close and personal what the governor and Dr. Marsh, Dr. Amjad, Secretary Crouch, and the whole team continue to press on these vaccinations and the additional dosages for people over the age of 50. Thank you.
All right, thank you, sir. Next to Secretary Bill Crouch with the DHHR.
Good morning, everyone. I want to talk a minute about recovery residences. A recovery residence is a sober, safe, and healthy living environment that promotes recovery from alcohol and other drug use and focuses on the improvement in one's physical, mental, spiritual, and social well-being. Other common names for recovery residents are sober living homes, halfway houses, and recovery houses. DHHR's Office of Constituent Services is now helping with recovery residents' complaints and inquiries. West Virginia residents may call 1-800-642-8589. That is 1-800-642-8589, Monday through Friday from 9 to 5 p.m. to express concerns regarding recovery residences. This new procedure provides a more effective way to track complaints and direct referrals to appropriate agency for resolution. So, thank you.
All right, thank you, Secretary. Dr. Ryan Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. This is going to be for the governor, and obviously you've been very clear on the abortion issue. You would like to see a special session earlier rather than later. I know you've said that you're waiting for the thumbs up from lawmakers as to when to call that special session to deal with that really old abortion felony law. But as you are probably aware at this point, that's in the courts and is looking like it's going to be heard by the state Supreme Court probably later than January 2023. So that's a pretty long time. And of course, it's under preliminary injunction, that law, which means abortions can continue in the state of West Virginia until the Supreme Court makes a decision whether to uphold that preliminary injunction or stay it or what have you. I guess my question is this twofold. One, some of the language from that advisory opinion from Patrick Morrissey was used as part of Judge Salango's reasoning for granting the preliminary injunction. And then so I'm kind of curious to know whether you think that that advisory opinion was helpful to what you all want to do with changing that law. And then the second question is, do you think you can even have a special session at this point while that law is apparently, sitting around waiting for the Supreme Court for the finally hear arguments in that case, one way or the other? Thank you.
Stephen, to be perfectly honest, and that's what I always try to be with you and everyone, and it's just this is I've got to entrust the legal minds way, this is way out of my pay grade, and from the standpoint of clarity right now, I don't have it. I've really tried really hard to do this. I have tried to give the legislature the time where they would need adequate time, to be able to talk to their membership and everything and get their act together in a way where they were ready to take this up. From the standpoint of the Attorney General, I think he's doing a marvelous job and everything, and there's surely issues that need to be discussed, within everyone. But from the standpoint of the technicalities and the legalese, can this be done now or can it not be done? What's going to happen with this injunction and all this kind of different things that are going on? Those are questions that the legal folks are going to have to give to us and everything. And thus far right now, I don't have clarity. So really and truly, to give you a personal opinion, I won't do that because, I truly believe that first and foremost, the legal community needs to give us real rock solid advice. And then from that, the legislature needs to speak. That's where we need to go. All I would tell you is the laws that are on the books are old. And without any question, they need clarification and everything. And that's what, the people of the House and the Senate will do for us and everything, and along with our Attorney General. So we've got to have some more time and get a whole lot more clarity on that.
All right, thanks, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi. Thank you for allowing the question. I do have an update. Occasionally, we've talked about the impact of the COVID pandemic. We've had 7,121 deaths in West Virginia. That would rank as the 22nd largest city in our state or area. It's just behind Dunbar, where I live, at 7,166. So as the governor and everybody else has mentioned, it's not gone away yet. And speaking of that, on a personal note, I was infected a couple of weeks ago. Thank you to Drs. Marsh and Amjad and General Hoyer. I was able to talk with them. They were able to help me out, and I appreciate it very much. So thank you. I wanted to thank you publicly. Governor, I have a question for you. The West Virginia Center on Budget and Policy has released a blog post with some observations about the 10% budget cut that you're asking the legislature to consider on Monday. Very quickly, and I'm certain you've heard these before, that some of the warning flags from them are that you're using a one-time surplus for a continuing break, which could cause problems in the future. That middle-income West Virginians with that incomes between $35,000 and $55,000 get an average tax cut of $120, but the wealthiest 1% of West Virginians, the average tax got to be about $3,100. Obviously, they pay more taxes, so a 10% tax would do that. So basically, what they're saying is that there's no guarantee of continuing revenue to fund this, that it would benefit richer West Virginians much more than middle-class West Virginians, and that they believe it's just a mistake to be asking the legislature to do it this time. That being said, have you talked with legislative leaders, and what do you expect to happen on Monday when the special session gets underway? Thank you, sir.
Well, Kenny, there's several different facets to your question and everything. Let me make as good a run at the whole thing as I can. First of all, there's been unbelievable discussion, from the standpoint of us, the revenue folks, and all that. I really believe just this. From the Senate side, our Senate president is really hung up on the property tax on vehicles and the machinery and inventory tax. And frankly, just to tell it like it is, we'd like to in this world to be able to do any and everything. I frankly have a completely opposite opinion from the standpoint that I'm not driven by, I'm not driven by, anything as far as influence or lobbyist or anything from that standpoint. But I personally believe that if you want people to come to West Virginia, if you want real growth within our state, without any question, we need to get on some level of pathway to try to get rid of our personal income tax, or at least lower it. This is just the first step. And the revenue folks and everything tell us without any question, this is a very, very conservative and very sustainable first step. Now, with all of that, Kenny, we can't do it all and do it all at one time. We have people in the state of West Virginia, and just like it or not like it, we got a lot of folks in West Virginia that are hurting today, and this is a way to put some immediate monies back in their pocket. That's what we want to do. It is a first step to reduce the income tax in the state of West Virginia and put money back in their pockets. Now, what I've tried to do, I've tried as best I possibly can to make it as fair and equitable across the whole spectrum. Now, just think what you really try to do. From those folks that are making $0 to $10,000, we basically went from a 3% income tax to a 2%. That's a 33% reduction in their income tax bracket. From the standpoint of looking at then what we got to do is as we move up the spectrum and everything, we've got to look at ways to bring the job creators, the real job creators to West Virginia. So we lowered from the highest bracket, which they're paying a whole lot more taxes. It's not really very, very fair to say, well, they got X number of dollars and down here you're getting X number of dollars. You've got to look at the percentages. And from the highest bracket, we wanted to get it under 6%. And so what we did is we lowered it from 6.5 to 5.98. Now that's about 9% versus on the lowest end, 33%. Now we've tried to attract job creators, and we've tried to help the folks down in the lower brackets, that are having a really tough time. We try to make it as fair and as equitable as you can possibly make it. Now, from the standpoint of where we're going to go with this, there's Amendment 2 that's coming up for a vote. If it were successful, and I, have a lot of questions about that, but if it were successful, then, as we develop other taxes, those taxes are going to take, or reductions are going to take a long time, if ever, to get right into people's pockets. So I'm trying to do something that is an immediate response, but right in their pockets. It is a philosophy difference. I think really and truly through time, from the day that I walked in the door, things absolutely have worked, and I'm confident with all in me that the reduction in personal income tax is exactly the way we ought to go. And I commend, Chairman Householder. I mean, this program is very much in line with what Chairman Householder has been wanting to do. I wanted to go more aggressively, and today what we're putting out there really and truly is the maximum that we can do and still follow along the guidelines or the restrictions of ARPA. This is a silly place at times, and really and truly, egos get in the way an awful lot of times. From the Senate standpoint and the House standpoint, we have wanted a reduction in our personal income tax. We've passed these things before, from the standpoint of starting slower. And so that's what I've tried to do. From if you just look around, I mean, you don't have to look around very long, and you can answer yourself really questions just like this, Kenny. We have for all practical purposes a really low, personal property taxes in West Virginia today. Our property taxes, our personal property taxes are pretty daggum low. If that were the answer, to lower them more, if that were the answer, why have not more people already come? You can't possibly tell me that versus getting rid of the personal income tax is even comparable. And the other the other things that are at play here is just this. We've been in negotiation with everybody from the green power people to Nucor to everybody under the sun. I have yet to hear one person come back and say, well, we'd come if you got rid of that inventory and manufacturing tax or machinery tax. And the last thing is just this. Think about what Jim Justice would benefit the most from. Well, Jim Justice and Jim Justice's companies have got tons and tons and tons of machinery and vehicles and whatever it may be. And I would benefit unbelievably from that. This isn't about me. This isn't about egos. This isn't about that stuff. This isn't about running for another office or running for the highest office or whatever it may be. This is about doing the very best thing that we can possibly do for the people of West Virginia. I commend Chairman Householder. I've spoken to the Speaker of the House. And really and truly, I just believe that, really when it really boils right down to it, we've had lots of discussions, through different people, with the Senate President, the Finance Chair, different people there and everything. It is a philosophy of real difference. The real difference is just this, is at the end of the day, we can't do it all. We can't do everything at one time and everything, but this is a way to put your foot in the water and get moving and moving forward in a really prudent way. Now, say what you want, but that's what I've done as your governor, and that's how I've led you. If we want to go another way, well, we just go another way. And if we want to go another way, then shame on whomever, not shame on me. I absolutely, positively know this is the way we need to go.
All right, thank you, Kenny. Next to Mark Curtis with Nexstar Media.
Good morning, everyone. I'm going to pivot in a completely different direction here. Governor and maybe Secretary Crouch will want to answer this as well. We've had some major outages or problems with the computer system at the DMV this week. I'm wondering if you can give us a progress report on get everything fixed and back online. And if I'm not mistaken, some DHHR computers were also affected. So I'd like to ask Secretary Crouch to address his part of this, Crouch, and just kind of give us a status report of where things stand and whether the public is being affected in any adverse way at this point.
Well, Mark, Secretary Crouch can come on and talk about it too, but for what I know, we're still working on the problem and everything. It's a systems issue with IBM. It's expected to be fixed real soon, but it's a problem. And maybe Secretary Crouch, you could, take it. We're not there yet, but everybody's working and we're trying to get to the finish line. But Secretary Crouch, do you know anything about this?
Yes, Governor, thank you. And you're right, it's a hardware problem. IBM's working with the team at OT, Office of Technology. It's affecting many state agencies. It primarily affects DHHR's PATH portal. WV PATH is a portal for individuals, the public, to seek services online and to apply for benefits. They are still able to do that. So the PATH system is working from the public portal standpoint, but the information is not getting into DHHR, and it's one of our biggest issues right now. So Those are backing up a little bit. The time to respond to those is stretched out as the problem is getting resolved. Folks can still apply, but we can't see those applications until the system is fixed. So there's going to be a big log jam here that we have folks standing by to tackle as soon as the system is fixed. I want to thank OT for Office of Technology. They're doing everything they can do. We actually get updates 3 or 4 times a day in terms of the status of this. We don't have a deadline right now in terms of the absolute fix, but we hope that's very soon. We will keep you posted through press releases, et cetera, with that. So thank you, Mark.
All right, thanks, Mark. Next to Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News. General Hoyer, I wanted to ask you to follow up what you said about our Novavax shipments. I had read that, quantities were very limited. Some states, they said, weren't going to be able to widely distribute them to the beginning of next month. How many are we getting, and where are they going to be able to go? Thank you, sir.
Charles, we won't have a full understanding of that until that order process opens on Monday, and then we'll be able to get to folks. We'll do the same thing as with other vaccines. There'll be some level of central ordering that the GIADF will be able to manage and help move around the state, and then pharmacies across the state and certain clinics should be able to order directly as well. But we'll have more information the first of the week on the total numbers available.
All right, thanks, Charles. Next to Mark Cram with WDVM.
Well, good morning. Good to see all of you. And first, I just want to say, I don't think the public realizes the commitment, the dedication that the 5 of you have made during this pandemic over the past 2 years. So you're to be commended for that. The hours spent just must be in the millions. So just wanted to convey that. Governor, comment from a Berkeley County resident: in working out our family budget, the first thing we do is consider our monthly expenses. Has the state carefully considered the expenses that need to be met that would also be able to be met with the proposed tax cut? Thank you.
Mark, do it one more time, because I want to make sure I've got the question right.
Okay. Says in working out our family budget, the first thing we do is consider our monthly expenses. Has the state given consideration or taken a hard look at the expenses that will need to be met, and are you able to meet them with the proposed tax cut?
Absolutely, Mark. Without any question whatsoever, that's what I'm all about. That is exactly the very point that I'm all about. We can put ourselves on a pathway to something that is going to drive growth into West Virginia. Now, let's think about it, Mark. And I really appreciate your comment about the hours and everything that these great experts have put in and everything. Maybe not, but I give lots and lots. Well, first and foremost, credit to God above. And secondly, these experts have done a great job. But Mark, let's step back and think about this whole thing. First of all, there are ARPA regulations or requirements that said if you exceed a certain number, they can claw back and take money back that the federal government has sent us. But we don't want that to happen at all. So we have absolutely got this at a level that qualifies for the ARPA requirements, period. The next thing is, without any question, we know this is a very conservative and sustainable level that we can be at. And from that standpoint, we know our people are hurting, and we want absolutely to be able to do the thing that moves the needle the most going forward in the future, that brings more potential growth and everything, and gets money in the hands of the people today. I'm exaggerating a little bit there, that will get the money into people's hands much quicker than anything else we can do. Now, from the standpoint of the other proposals, and that's why I say, and I'm pleading with good people, for crying out loud, what do we need to be playing games with the people of West Virginia for? Why do we need our egos in the way? Why do we need that? We don't need that at all. Now, with all that being said, the other proposals that are on the table are, don't do anything now with this money. Don't do anything at all because we want the money. We need the money. And don't do anything now. Let's just wait. Let's wait. Let's go to an election process on Amendment 2. And then if it passes, and then we'll go back and we'll debate in the House level and as to whether or not we should extract the monies from the counties, the reliable resource they have, and let the state have the obligation to give that money to the counties as we go forward. Now, and with all of that, what you're going to do is you're going to build in a base build to our budget that we've kept almost flat. And your viewer that called in or whatever with the question, we have kept an almost flat budget, really minding the store. And that's going to jump to a gigantic level. If it jumps to a gigantic level, and just what if? What if we fall on a little bit of hard times? Then my concern is enormous. And my concern is not when I'll be here. My concern is when I am long gone. What will we do? We'll go right back to where we were when I walked in the door. And when I walked in the door, the only solution on the table was we got to cut. We got to make more and more and more cuts. And absolutely, without any question whatsoever, the more we cut, the more people left. And the more people left, you just continue to drag that hole right with you. Now, we've changed that, haven't we, Mark? And we're not dragging the hole with us now, are we? Well, somebody had to be the leader of the band. And that's where I came into play. Now, without any question, you know, from this standpoint, what we're doing is we're taking a baby step. And then as we get out in the future and we really see what the future brings us, we hope we can take another baby step. And then we hope we can take another baby step. And every time we take a baby step, we're really helping all of our people. All of our people. Not just, you know, not just one real class of people that happen to own all kinds of equipment or whatever it may be. We're helping all of our people. Mark, trust me. The one thing I'll do is I'll mind the store. I'll do my job. I'll absolutely do my job, and without any question, I'll do it prudently from a businessman's standpoint, from a person that's got ungodly experience in doing just this kind of stuff. We don't watch out, and we base build, and we jump to a level, it could cause a big-time problem. And so your viewer that called in with the question, I would say, tell him if we were to pass my tax cut reduction at this point in time, it'll put dollars in the hands of all of us. And without any question, it will bring more growth and it will drive us in the direction to have more growth. But what it'll do more than anything is it is sustainable and it is conservative in how we approach this. And without any question, if we don't watch out and we get too flamboyant and everything, and we jump too fast, we'll go right back to where we were before I walked in the door. And I think that'd be a big time shame. So that's my answer.
All right, thanks, Mark. Governor, I'll turn it back to you.
Again, even though I adamantly disagree with the philosophies of the Biden administration, I ask for your prayers for our president, and I've sure offered up mine. The job of the presidency of the United States should be respected in every way. I've tried to be respectful. I absolutely believe, without question, that the Biden administration's ideas and what they've done has caused a lot of harm and a lot of damage to our country. But nevertheless, our president's not feeling good, and our president surely is the President of the United States of America. It is absolutely the office that we should all recognize of the importance and value and beauty to. So I ask you to offer up your prayers. You know, from the standpoint of what's going on down here, you know, oftentimes too many games, oftentimes, you know, egos getting in people's way and everything else. And I hope to goodness that we don't get into that. We don't get into a hollering match as far as who can yell the most or who can bully this person the most or whatever. We don't need that. We don't need that. And to be perfectly honest, at the end of the day, if we want to go another way, you know, from my standpoint, you know, I'll sit back and say, you know, go the way you want to go. At the end of the day, if it's a wrong move, you know, I'll still try to help and do anything and everything that I can possibly do for West Virginia, and that's what I'm going to continue to do until the day I'm gone, until the day I die. So, nevertheless, thank you so much.